Hi. Urinary tract infections are really a big problem among the Alzheimer's population. Now, some of this is caused by, as they get deeper into the disease, that they may forget that they have to go to the bathroom, or they may be uncomfortable and not want to move. They just, would rather just stay put. This is something that we have to avoid. I know from my own mom, again, here we go with my mom, but she had so many UTIs, it was just unbelievable. Whenever I would go to the facility, she always had a big glass of water next to her. And I think it just sat there all day. I don't know that she was drinking it, but when I'd say, Mom, you got a drink, she'd say, Look, I got a glass right here. Sure did. And that's where it stayed. Um, One of the things that you may or may not know is if your loved one starts to behave differently than their normal personality, if they start to kind of get angry, agitated, um, and they can be downright nasty at times, but they're not trying to be. They don't understand what's happening to them, or they might want to sleep and they might not want to eat. There's a number of things that a urinary tract infection can, kind of display itself as. And once you start seeing how many they are having, you'll recognize the symptoms. But if their behavior seems to be off on a particular day, the very best thing to do is check, because that could be your very first sign that, if their personality changed, like from yesterday to today, or even the morning to the afternoon, it could be that they're just not feeling well and they don't know how to express it, so that they can become belligerent and sometimes rather nasty, or they may want to sleep a lot. So be aware of some of these signs that you wouldn't normally think would go along with a urinary tract infection. How to prevent them? Lots of water. You want them to move as much as possible. It will help them. Uh, if they are wearing Depends or some kind of pull up, you want to make sure that they are changed very frequently, because just like with a baby, if a baby is sitting in its little, wet diaper, they can get a diaper rash. And our loved ones here also get rashes from this. And it also, sometimes they will actually bleed. So if you notice that there's blood in their urine or something, get a hold of the doctor right away. As you see more and more of this, you'll catch the symptoms earlier. You'll know what to look for your particular loved. But it's really a big problem in this group of people. You want to see if you can get them to move around. Sometimes they won't want to go to the bathroom, whether it be because they're uncomfortable, or they might even fear that it could burn. Um, it really is a big problem. And once they get that rash, I remember one time my mom's wasn't even a rash anymore. It was just like on fire. It was red, red, red. And I went to talk to the staff, because I know they're busy, but everybody has to have attention that they need. Now, this may, and again, Mom was in a great place. I mean, I've tried to put her in the best that we had in our county. So it can happen. You want to make sure they're overloaded with people, they have short staff. So you really do have to step in and make sure that your loved one is being taken care of properly. Uh, the the other thing is, you want to keep bathing their, even if they don't take a bath, which, as we've discussed, really isn't necessary for them unless they have an accident. But you want to make sure that their bottom area is gently cleaned and dried and make sure, just like, I keep going back, but there's so many similarities to what you would do with a little baby. You have to protect them because they can't do it themselves. And to have a urinary tract infection, if you haven't had one, I hope you never do. They are not something you want to deal with. And many of these people have them over and over, and it's just horrendous. But with the ladies, you want to make sure, and I was surprised. My mom had never heard of this. You always wipe a female from the front to the back. Very, very important, because you're going to get bacteria into places it doesn't belong, and that's going to just make the infection worse. So lots of water. Now, some people, and I would discuss it with your doctor, but cranberry juice, some people believe in this. I don't know if it works or not, but you could discuss it with your doctor, and just make sure that if they're in your own home, then you'll be able to really probably minimize this. I'm not saying you can do away with it, because I don't know if it's possible, because I know earlier when mom was with us, we tried everything we could, and she just had a real problem with her kidneys, and also her her whole tracts, urinary tract, was really a problem that had come from a surgery she'd had earlier, and it didn't go well, that surgery, and it caused this great problem for her. But when you are taking care of them, you want to make sure they're clean, they're dry, and if they are still wearing underwear, cotton is much better. It can breathe, and you want to get some air, going, and that will make it better as well. And just make sure that they're getting regular bottom washes. I mean, you could even get a bidet. That would really be wonderful. I don't know if you've used a bidet, but they're actually quite nice. And I think that your loved one, after the first round, because it's kind of a surprise, but it's very nice, and the water can be very gentle, and she can, or he can, get cleaned nicely that way, and then you can just dry them. And just make sure, if the thing I really want to stress, if your loved one starts acting out of the normal, if their behavior or their mood all of a sudden is really off, first thing to look for is a urinary tract infection. It can do crazy things to them. I mean, they can get, it must be because of the pain and they don't know what to do, but they can get a little weird, I guess, not their normal, loving selves. And I'm sure they're frustrated, and sometimes they can't express it. Um, the communication can become very difficult. So if you're aware of all these symptoms, then you'll be better off. I have a much more detailed blog post that you can look on and see, more about it. But I just wanted to come here and just kind of tell you personally what might happen. But you definitely, those pull-ups are great, but at the same time, they can really hold in moisture. And we don't want that. So take a look at the blog. You can get that at Alzheimer's Support, the number 4, the letter U.com, and you will find each of the little things that I'm doing. I will also expand on it in a blog for you. So I hope that will help, and just keep an eye on them. Thank you so much.